COVID infections are rising again, bringing fever and chills, and for some at-risk populations, potentially far worse. Alison Northcott now on where in Canada it's spreading and how well the latest vaccine protects against the latest variant, known as Stratus.
This lab screens for wastewater for the virus that causes COVID-19.
Wastewater would tell us approximately 10 days to as much as a month ahead of time, ahead of clinical illness, what variants were entering the country and circulating.
Federal wastewater data show high levels of COVID-19 in parts of BC, Alberta, Manitoba, Quebec, and PEI. The current variant circulating most is called XFG or Stratus.
That variant causes mild to moderate illness. And we also know that the current vaccines that are in production and will be available in the fall should provide coverage.
With more people back at work and school, there are more places for viruses to circulate, while some are unbothered.
I've thrown out most of my masks because I'm not really afraid of the next pandemic or anything.
I've got the COVID fatigue, right? Because you hear about it over and over and over again.
Others are cautious.
We just don't know what's around.
And thinking about booking a fall vaccine.
I thought I was up to date, but maybe I'm not. I will have to call my doctor and find out.
If you can't remember when you last had one, it's probably time to consider getting another vaccine update.
Canada's Vaccine Advisory Committee says people over 65, those who are pregnant or people with underlying medical conditions should get an annual COVID shot. People over 80 or in long-term care should get it twice a year.
Those over 65, the risk of hospitalization is way higher.
For everyone else, this infectious disease specialist says ask your healthcare provider.
For those who are most vulnerable to hospitalization and death from COVID, the vaccine does a very good job in reducing the risk of that.
And with flu and RSV seasons on the horizon, experts say that protection will be particularly important.
Each province and territory will have its own vaccine rollout, most starting next month.